All right, let's get right into demystifying the winged butterfly blood collection set. Today, we're taking a magnifying glass to a tool that so many of us use literally every single day, breaking down its exact mechanics to see what makes it so incredibly effective. Whether you're just starting out on the floor or you're just looking for a detailed refresh, understanding the tiny nuances of your everyday tools is exactly what elevates your practice. Let's get to it.
It's incredibly easy to just get caught up in the fast-paced, everyday routine of the clinic. You grab your kit on autopilot, head straight to the patient. But be honest for a second. Do you actually know your blood draw equipment inside and out? Truly intimately knowing your tools? That's the absolute foundation of patient safety, procedural efficiency, and honestly, your own confidence.
Okay, let's dive into this setup. The core of this whole procedure is, of course, the winged butterfly needle. It's instantly recognizable, right? It stands apart from other collection tools simply by its distinct physical appearance. Specifically, those two flexible little wings protruding right from the sides. It's a super clever piece of design. But hey, before we even think about touching those wings, we have to start at square one.
And square one means reading the packaging. Before a patient is ever even involved, this is your vital first step. The manufacturer literally gives you a cheat sheet right on the wrapper to verify you've got the exact right tool for the job. It tells you what the equipment is, what it's used for, the physical size of the needle, and, absolutely crucial, the expiration date. Seriously, taking a second to verify these four details just acts as this quick mental checklist and creates the baseline for a totally safe draw.
Now, opening the setup isn't just about, ripping into the plastic like a kid on their birthday. There's a proper tactile sequence you want to follow in the field to keep things organized and, most importantly, sterile. Step 1, find the printed arrow on your packaging. Got it? Okay, step 2, hold that section and peel the packaging back. And step 3, just peel it completely open to expose the set inside. It's a simple 1, 2, 3 chronological sequence, but practicing it, that's what ensures a smooth, fumble-free setup every single time.
So once you've got it fully open, the very first macroscopic feature you're going to encounter is the sheath. This is that plastic protective cover sitting directly over the needle. And the golden rule here, it's all about timing. You do not take this cover off until the very last second, like literally right when you are actually ready to step up and use it on the patient. It completely protects the needle's sterility, and just as importantly, it protects us from any accidental needle sticks while we're setting up. Moving down from the sheath, we arrive at the namesake of the device, the wings. And this brilliantly illustrates how purposeful medical design really is. Notice how the sides of these wings aren't completely smooth? They're actually textured. Those textured sides are the specific points you'll actually hold and pinch together whenever you're going to stick the patient. That little bit of texture ensures your gloved fingers maintain a really firm, secure grip during a delicate procedure. It's a game changer for completely preventing the device from slipping at the worst possible moment. Plus, right on top of those textured wings, you're going to find a highly useful design quirk printed directly on the device itself. It's a little number. In the specific tool we're looking at from our source material, that number is 21. That tells you exactly what gauge needle you're holding. It's such a brilliant fail-safe, right? Because even after you've tossed the packaging we talked about earlier into the trash, the device is constantly reminding you of the needle's size, right there on the wings.
All right, trailing off the back of those wings is the tubing. Now, this isn't just some simple plastic line. It's the critical bridge for the whole collection system. Once you've successfully accessed the vein, the blood needs a secure, uninterrupted route to travel, and this tubing is that vital connected pathway. You literally get to watch the blood draw down through this flexible, transparent line, beautifully bridging the gap between your patient and your final collection point.
Now, what's really interesting here is the revelation that this single device actually houses two completely distinct needles. Mind-blowing, right? We naturally focus all our attention on the patient side. That's the needle under the protective sheath we just discussed, the one you maneuver using the textured wings. But wait, look at the tubing side. Way at the end of that long tubing pathway is a small gray rubber stopper. And hidden inside that stopper, a second needle. That hidden needle is what actually pierces your collection tube, creating the crucial vacuum seal that pulls the blood down the tubing and right into the vial. Of course, to safely and effectively use that second hidden tubing side needle, we need an accessory. Enter the Vucane tube holder. This sturdy plastic holder physically screws directly onto the setup right over that gray rubber stopper. Once it's securely attached, it provides a safe, rigid guide. You just push your collection tube right into the holder, it gets pierced by that hidden needle inside the gray stopper, and boom, your blood draw begins absolutely seamlessly.
So we've covered the setup, the anatomy, the pathway of the blood, the whole shebang. But as we wrap up the actual procedure, the focus immediately shifts to what is arguably the highest stakes part of this entire process: your safety. A direct quote from the source material hits the nail on the head here. One of the most important parts of it to prevent injury is the little safety activation. Preventing accidental needle stick injuries is literally paramount for us, and understanding exactly how your specific tool handles safety activation, that is absolutely non-negotiable.
So the crucial point is knowing exactly what type of safety mechanism your specific butterfly needle actually employs. Now, some models feature these fancy buttons that you hit to automatically retract the needle back into a plastic housing, but the specific version detailed here works a little differently. When you are totally done using it, step 1 is you slide the safety activation off to mechanically cover the needle yourself. Once you have it securely covered using that sliding mechanism, step 2 is immediate and final disposal. You take the entire unit, no disassembling, and discard it directly into the sharps container.
And, well, that brings us to our final takeaway. Knowing the microscopic and macroscopic anatomy of your equipment, from reading the packaging on step 1 all the way to engaging that sliding safety activation at the very end, it protects both you and the patient. It takes what could be just a mindless routine task and transforms it into a procedure you perform with total mastery and precision. So, armed with this structural knowledge, are you ready to completely master your next blood draw? Keep analyzing your tools, stay safe out there, and we'll catch you in the next explainer.